Hello, good morning, good afternoon, good evening, wherever you are today. My name is Edith. Oh my God, still. So, sorry about this whole. Thanks for joining me. It's my pleasure to be here today, and I am so excited to be talking about cancer. Thanks for all the feedbacks that I got last week regarding the presentation on STDs. And I try to make some adjustments, as you can see, but for some reason it's not being very effective. Now I had my PowerPoints presented, designed, and I was supposed to share my screen like I do with my students here, on when we do the Zoom learning or any of the other when we use any of the other video conference, what you call them, outlets to learn. But I can't seem to do with Facebook for some reason. I try to share my screen so you all could see what I have on there, but it's just not working. Then secondly, okay, I'm just gonna take off my glasses because I thought it was the reflection of the light, but of course something is not right. I just have to do away with this. I'm sorry. Okay, so today I will be talking about cancer. Thanks for joining me. I had done this presentation earlier. If you if you go to my page, you would see it. But I felt like I spent 17 minutes of my time talking to myself because what happened, I did not open up the video for live participation. So today I'll be talking about cancer. For those of you who don't know me yet, my name is Edith Declan Nkam. I am an Oncology Nursing Society certified chemotherapy nurse, and I am currently, you can join. We're not doing the room anymore because I was going to do the room because I was hoping to be able to share my screen with you all so you can see what I'm talking about, because I like to be visual. I want to make sure that I display a visual picture of what I'm talking about so that my learners or whoever is learning who might be more visual than audio would be able to understand. Okay, so but since that's not working, I'm falling back to the Facebook Live. Okay, so first of all, I'm going to be talking about cancer, and I am very passionate when it comes to cancer. The reason is, a lot of people have lost their lives. They've lost family members. They've lost loved ones over things that could have been prevented. They've lost friends, families, breadwinners over some of these, little things. Well, I call them little things because in the beginning they are little things. Now, these are things that could have been prevented by lifestyle modification, by early intervention, chemotherapy, surgery, removal of the part of the body, saving the remaining part of the body. Instead of dying, from something that could have been really prevented. So last week I was able to, I met one of my patients who was going home, and it was a very emotional period for everyone, for the patient, for the nurses, for the entire healthcare team, because she fought really hard. She fought really hard. Cancer is not something that is not for the weak-minded. A lot of people gave up on just the diagnosis of cancer, but that's why we're having this conversation today. A diagnosis of cancer is not a death sentence. If you're having cancer right now, if you have anybody who has been diagnosed with cancer, it is not a death sentence. Now, if you have never been diagnosed of cancer, I want you to listen attentively to what I'm about to say today. So first of all, I'm going to be talking about what cancer is. So cancer, a lot of us have heard about cancer, but we do not really understand what it is. Cancer is not rocket science. It is just an abnormal growth of body cells. So unlike normal body cells that grow and then stop growing, and then after a while they die, they regenerate. Okay, cancer cells do not do that. Cancer cells grow and grow and grow. They grow uncontrollably. They do not respect borders. They migrate from one part of the body to the other. Okay, so I'm just trying to make sure that I see who is participating, because let me see. Mm, just a second. Okay. So cancer cells just grow. They outgrow the borders, and then sometimes they actually overshadow. They cover up the normal cells. Okay, and that's at the point when people begin to have symptoms. So what causes cancer? Scientists, researchers, a whole lot of people have gone into looking forward to finding what the cause for cancer. But up until today, not so much has been discovered about what causes cancer. But of course, we can just, pinpoint one or two or three other things that people who do not have cancer have in common. So the first thing that I want to talk about is lifestyle modification. Just give me 1 second because I feel like something is not right with this. Let's see. All right. Okay. Well, hopefully. All right. Hey. Hey, Chidima. How are you doing? Good to see you. Okay. So there are some things that place an individual at risk for cancer, any kind of cancer, breast cancer, brain cancer, testicular cancer, prostate cancer. Certain things like lifestyle, environmental a huge role in predisposing an individual to having cancer. Now, when I talk about lifestyle, I'm talking about smoking, I'm talking about diets, high fat diets, diets that are not healthy enough, diets that just do not enable the excretion of toxins from the system, lack of exercise, obesity, things like unprotected exposure to chemicals, smoking, secondhand smoke, air pollution, industrial pollution, chemical exposure, water pollution. Some of these things can actually predispose an individual to having cancer. Then the other thing I want to talk about is genetics. Some people have a higher genetic risk factor for cancer. So there is a BRCA1 and 2 genes, which are just proteins that help in DNA breaking down of DNAs. So occasionally, some people have an excess of the BRCA1 and 2, and these people are those who eventually have breast cancer. Okay, now the first thing I want you to know about breast cancer is the moment you begin to find out symptoms, then something bad is really about to happen. Yeah, and that's why we always encourage people to go for annual screenings, do annual blood work, do your colorectal screening, do your prostate exams, do your pap smears. These are just screening procedures that help detect cancer cells. Now, if you don't do any of these things and then eventually you start having some of the symptoms I'm going to be talking about later, then you know that, I mean, the the chances of treatment are really, really, really reducing. Okay, so some of the symptoms that I want us to pay attention to are like for colon cancers, GI related cancers. People could complain about change in bowel habits. So what happens? You go from having a diarrhea to constipation to blood in your stool, or to having a lot of gas and all of that. Change in bowel habits. Any kind of change in bowel habits can actually be an indicator to something wrong. Now, when you have sores that don't heal, it could be anywhere. It could be in your mouth, in your genitals, it could be on your skin. If you have a mole that is gradually changing in size and symmetry and color, then you need to go see a doctor. Now, if you begin to have unusual bleeding, and that's where the annual blood exams, the CBC and BMPs that we do every year comes in. Now, these will help detect blood related cancers, leukemias, for instance, when there is a low or elevated white blood cell, when there's a low or elevated platelet, when there's a rapid destruction of blood cells. The annual CBC BMPs can actually help. And of course, with the BMPs, we're looking at your kidney functions. So if your kidneys are having any issues, even if it's not cancer, the annual exams, the BMPs can actually help with the creatinine numbers to detect something wrong with your kidneys. Now, for the women and even the men, if you begin to feel any lump, any thickening in your breast, in your scrotum, in your testicles, wherever you begin to feel any hardness or any lump or any mass that is hard and not movable, then you might need to go see a doctor. Now, when you begin to notice changes in the consistency of your skin or in the consistency of anything on your body, then you need to go talk to a doctor. Finally, for those with lung cancer and esophageal cancer, mouth cancer, when you begin to feel any hoarseness, you can't talk all of a sudden, your voice is sounding deeper or unusual, and it's not a cold, you don't have a cold, then you need to go see a doctor. All right. So according to the American Cancer Society, we use this acronym. It's called CAUTION: change in bowel habits, a sore that wouldn't heal, unusual bleeding, thickening, indigestion, obvious changing in your skin or any part of your body, and then any kind of cough or hoarseness. Now, this brings me to the different types of cancer. We have a whole lot. It's a whole lot of cancer every day. There are blood cancer, skin cancer, brain cancer, breast cancer, prostate cancer, brain cancer, oral cancer. Just think about it. Every part of the body has a potential for having cancer. So, but of course, we're not going to talk about all of them. Just for the sake of this singular presentation, I'm only going to be limiting myself to breast cancer, and then subsequently, or in the future, I would be also talking about prostate cancer, cervical cancer, and maybe one or two other cancers that actually have screening methods for prevention. All right, so there are certain things that you can do to prevent cancer, and just like I said in the beginning, scientists and researchers have been on the lookout for causes of cancer, but up until today, it seems like nobody really knows what causes cancer. But of course, 9 out of 10 times you can keep yourself away from harm's way. Now, if you practice, if you practice some of these things I'm going to be telling you about, you are definitely reducing your risk for having cancer. First of all, you want to increase your physical activity. I know it's almost impossible for some people to exercise, but thinking about the disadvantages of not exercising, it should keep you getting ready to do those. So try to do exercise as little as you can. You don't have to go to the gym from Mondays to Sundays. You can walk around your neighborhood, walk around the park, ride a bicycle, just anything that keeps your metabolism high. Now, there are other things such as healthy dietary practices. When you eat healthy, it keeps cancer at bay. Eat more vegetables, eat more foods that are high in antioxidants. And when I talk about antioxidants, I'm referring to berries, blueberries, blackberries, grapes, nuts, green dark leafy vegetables, any green vegetable. Just stuff yourself up with vegetables. And of course, think about it. It helps clean your colon, it helps clean your GI tract, and prevents the adherence of some of these toxins to the GI walls. Okay, now you want to also reduce exposure to smoke. If you smoke, try to, as much as possible, cut off smoking completely. And then don't hang around people that smoke a lot, because that exposes you to secondhand smoke. Now, if you have, for radiation, there are people who have to have occasional x-rays and all of those exposure to radioactive elements. Now, for those people, you want to try as much as possible. Don't go having an x-ray, every other day. No, that exposes you to radioactive elements. You don't want that. So do the screenings that are necessary when necessary, because overexposure to radioactive elements can actually increase your risk for cancer. And then also, when you go to the beach, when you stand in the sun, when you do your tanning and all of that stuff, make sure you wear some sunscreen. Some sunscreen will prevent you from having melanomas, and those are basically skin cancers and different other skin cancers. Now, I'm going to talk about something very important. That's immunization. Immunization is very, very vital for preventing certain cancers like hepatitis B and the human papilloma virus. So, hepatitis B, usually people get the recommendation is 3 doses, 1, 2, and then the 6th month. So usually babies get them, but if you didn't get them as a baby, you can also go get them as an adult. Now, for the HPV virus, it predisposes the women to cervical cancer. So the recommendation is girls from 9 till about 21 years old can go get the vaccine to prevent cervical cancer. Now, I'm going to be talking about how to screen for HPV in women who are greater than 30. But just for right now, I need you to know that there are vaccines for preventing HPV. So if you have kids from 9 to 21, you might as well just want to go get them vaccinated. And then finally, safe sexual practices. Yeah, last week I talked about anything that alters the integrity of your skin, your mouth, your genitals, whatever it is, anywhere you have a sore that hasn't healed, you want to try to, as much as possible, protect that part of the body from any other bodily fluid. You do not want anybody else's fluid getting into your skin that is compromised, because that could actually increase your risk for cancer. All right. So there are screening tests for cancer, and I'm going to just go through them real quick because I don't want this presentation to be too long and boring. But thank you all for those of you that are watching right now. I really appreciate you. You all are my motivation. I was already tired when I tried to figure this out and it wasn't working. Okay. So thank you all for standing by. Now, screening test for the colon. We have something called the colorectal cancer screening, and it's called a colonoscopy. The recommendation is adults, whether men or women, once you're 50 years old, you need to go get a colonoscopy. And that's basically just the insertion of a camera, a tube with a camera. It looks into the whole colon. It looks for polyps. It looks for any kind of abnormal tissues in the colon. And of course, if a polyp is found, it can be clipped off before it becomes cancerous. And if there are any abnormal tissues or abnormal if the colon or any part of the GI tract looks abnormal, then an early detection can actually help with better treatment outcomes. For breast cancer, you want to have your mammogram. For women who are greater than 40 years old, an annual mammogram is recommended. So you go to the doctor's office and then they just put the breast in between two plates, and then it just, it gives a picture of the whole breast tissue. Now, for those that are less than 40, if you have a first generation relative who has breast cancer, then you might need to go see the doctor before you turn 40. So besides the breast cancer, it's also recommended that the younger women, and every woman does a self-breast exam every month. So every month, right after your period, you want to stand in the mirror with your hand at the back of your head, and then you just palpate around the breast, starting from under your armpits, and then you go in a circular motion, just trying to feel for lumps or masses that are hard and not movable. Many times cancer cells do not, masses from cancer do not really hurt. They're not painful. So that's why they're able to grow so much without people recognizing them. So when you check your breast, make sure you feel for lumps or irregularities or anything that is abnormal. So that means you have to know yourself. You have to know what your breast looks like on a very good day. So when there are abnormalities or there are any changes in size or whatever, one breast is beginning to look bigger than the other. One nipple is beginning to look more retracted, is more dimpled, is more discolored. Then it's time for you to go see the doctor. Okay, then prostate exams. It's recommended for men who are at least I think 50 years and above to go have an annual prostate screening. So I mean, sometimes it's uncomfortable. They do a digital rectal exam. The doctor goes in through the anus and then is feeling for the prostate, for an enlargement of the prostate. So, but honestly, that keeps you away from harm's way. So prostate exams are very important to preventing prostate cancer. Now, if you go have an annual prostate specific antigen, which detects the presence of abnormal prostate cells. Now, certain numbers can actually tell you a lot about your prostate health. So I wouldn't want to be very particular, but then if your PSA is greater than 4, then it's time to actually go get screened even more often, because something could be wrong. Now, with the presence of an infection, your PSA could be high, but then you want to also rule out the fact that there's an infection. You want to proceed further to ensuring that you don't have any abnormal cancer or abnormal cells or growth of your prostate. Okay, for skin exam, you want to look at your skin. Take a very good look at your skin, your back. If you can't see your back with a mirror, you can have your child, your partner, whoever it is, look at your back. You want to look at every part of your skin and ensure that that you're not having any new or irregular cells on your skin or irregular growth on your skin. All right, so I will talk briefly about breast cancer. I know this is a big one because every day, I work with people with breast cancer, and some have survived, some did not survive. And I know that one or two of you watching me right now probably know someone who has breast cancer or someone who has died of breast cancer. It's something that has really changed my whole perception about life. It's changed the way I see life. It's changed, and not just breast cancer, cancer in general. It's one part of life that I still cannot understand how it happens, and the kind of changes it brings to the individual, the family, the jobs, the everything. So that kind of defines or explains why I'm really passionate about this topic. So for the breast cancer, I already talked about risk factors, BRCA1 and 2, and then smoking can also put the individual. And now when I talk about breast cancer, men also have breast cancer. Not as much as women, but men do have breast cancer. Thank you so much, my Reverend Obadinobi. Thank you so much, Kikalomo. I really appreciate your inputs. Thank you so much. So breast cancer comes in stages, and just like every other cancer. Now, the first stage is when the cancer is still in situ, and it means that it has not metastasized. It's still right there in the tissue. Okay, so with the first stage, I will talk a little more about treatment options down the line. Now, warning signs for breast cancer. I already told us about how to screen for breast cancer. Breast self-exam, mammograms, and ultrasounds can help detect breast cancer. Now, there's something I forgot to mention earlier. We have things called the fibrocystic breast diseases and the fibroadenomas. So these are just benign breast cysts that occur in women's breasts, in the breast tissues, probably around the menstrual cycle, somewhere around the period, maybe a week before the period or during a woman's period. So these are not malignant. These are not cancerous. But of course, if you've had this for a while, you might need to go just rule out the fact that they're not breast cancer. Go get a mammogram, an ultrasound, or whatever screening your doctor might prescribe. Now, I actually had this PowerPoint designed for this presentation, but I had a hard time getting to share my screen. So I will just turn my camera around so you can see what I'm talking about. Now, one of the warning signs for breast cancer is something I call peau d'orange, and this is exactly what it looks like. You see the breast looking like orange, the skin of an orange? That is exactly what the breast looks like in some people with breast cancer. So when you start noticing your breast beginning to have this whole orangey kind of look, then it's time for you to go see a doctor. The next is what I call a nipple retraction. Some people have nipple retractions normally. Some people's nipples are retracted. But of course, if you wake up one morning beautiful morning, you just get out of bed and then you notice that one of your nipples is retracted looking this way, then you need to be worried. You cannot just assume that everything is okay. It's time for you to go see your doctor as soon as possible. Next is a dimpling. This is not the best picture, but this lady looks like she already had something going on. She probably had a surgery. But right here, if we notice, we see the dimpling. It's just like, well, for those of you that know me, I have a dimple on my cheek. So if you have that kind of dimple anywhere, it doesn't have to be under the breast. It could be anywhere, and that's why it's very important for you to take a look at your breast every day. Every day you wake up, take a look at them, compare the sizes, compare the shape, compare the color, compare the temperature, how warm or cold either of the breast feels. All right, then the next sign of breast cancer is the milky or bloody nipple discharge. Some people might not necessarily have a bloody discharge, but of course, when you press on your nipples and you find that there is any kind of discharge, hey, if you're not breastfeeding, if you're not taking any contraceptives, you should not be having discharge. You should not be having nipple discharge. So at any point when you realize that your breast begins to have discharges, then it's time for you to call your doctor's office. Okay, the next is breast redness and discoloration. Now, in women that are breastfeeding, occasionally they have something called mastitis. Mastitis is an inflammation of the breast. But of course, if you're not breastfeeding and, over time, 1 week, 2 weeks, 3 weeks, your breast begins to change color. It begins to look more reddened. Maybe one breast begins to look more reddened than the other. Then it's time for you to go see a doctor. Do not wait until things get out of hand. All right, I'm going to switch my camera back and you can see me. Okay. All right. So basically, women have to be very familiar. Women, men, everyone has to be very familiar with their bodies. Your breast, your penis, your every part of your body. You need to know. So when there is a change, you can actually determine that the change has occurred and you can go seek care. So there are recommendations for breast cancer screening, like I had said earlier. Women 40 and above need to go have yearly mammograms. But of course, if you've had a first-generation relative, your brother, your sister, your uncle, your dad, your mom, anybody around you who has breast or who died from breast cancer or who had breast cancer, then you need to go seek care even before you turn 40. Now, unfortunately, we Africans are not as good as the Western, the people in the West with keeping statistics and cost and identifying cause of death. So if you have no idea if you had a relative who had breast cancer or who had any kind of cancer, and then you begin to realize that you begin to have any of these symptoms, it's time for you to go see a doctor. All right, so treatment options for breast cancer include lumpectomy, and lumpectomy is only useful when the cancer is still in situ, meaning that the cancer is still in the duct right there. The lump can be taken away. That is called lumpectomy, removal of the breast lump. Now, when it goes beyond the lump and goes, spreads around the tissues of the breast, then the doctors or the surgeons can perform something called a mastectomy. Mastectomy is pretty much the removal of the entire breast tissue, maybe leaving about 7% of some breast tissue just in case the individual wants to do a reconstruction. Then the third one is radiation. Radiation is very useful. It's proven to have worked, but that, of course, it is only effective when the cancer has not metastasized beyond the initial point of attachment. And then finally, chemotherapy. Chemotherapy is more systemic. It targets cancer cells all over the body. So it's basically an infusion of chemo medication into the bloodstream to destroy rapidly growing cancer cells. And then, of course, there is life after breast cancer. But you have to identify these things. You have to know. You have to be able to teach someone. You have to be able to, when you see someone, your wife, your sister, your friend, anybody talk about, oh, I got some changes in my body. I have some changes here and there. You should be able to tell them, hey, you need to go see a doctor. And that's the reason for this presentation. I want every one of us to have this knowledge. I want every one of us to be able to identify these diseases when they show up, so that the death rate can actually be reduced. So after breast surgery, of course, you can go have, I mean, the individual can go have a reconstructive breast surgery, and of course, they still look great, probably even better. Okay, so why lose a whole life when you can only lose maybe an arm or a finger or a breast or something? All right. Thank you so much for joining me. I really appreciate you all. I am so sorry I had to change the time because um, work schedule kind of shifted around a little bit, but of course I really wanted to do this, and that's why I had to do it a little earlier. Thank you all for joining. Thank you all for watching. I hope we all begin to live healthier lives and begin to join in preventing all the diseases that can be prevented. Thank you so much and have a wonderful one. Bye bye.